Dear friends, welcome to this episode of CNS Viewpoint. Today we are going to discuss about a very important issue again, and that is the window is closing. The clock is ticking and we are really losing time. We are running against time on ensuring that the whole world or a maximum population gets vaccinated globally, so that our chance of curbing the pandemic are strongest. So as of now in India, if you look at India, like about 10% of the population is reported to be fully vaccinated, and we have to vaccinate about 70 or more percentage of the whole population, eligible population, as within a reasonable time, like 8-9 months, or maybe by end of this year. That's a very challenging target if you compare that vaccination in India began on 16 January 2021, and this is August of 2021. So with 7-8 months down the line, we really are way behind where we should have been in terms of ensuring that a large part of our population is vaccinated. But if you look at the states, even the vaccination rates are very are not uniform. But before that, let us look at the global level. Around the world, if you look at, there are countries which have vaccinated a very large number of its population, like over 50%, 60%, or 70%, such as Qatar, Portugal, Singapore, Uruguay, Spain, Denmark, Chile, Canada, Ireland, Belgium, UK, France, Italy, Germany, US government, and others. They have already vaccinated more than half, or even almost 2/3 of their population. This is the best desirable level of vaccination given the short span of time since the vaccination was rolled out. We are also seeing a response, an effect, an impact, because in those countries, if you look at those countries, the hospitalization, the need for oxygen, ventilation, or deaths, for instance, due to COVID, are less in people who were fully vaccinated, and way more in people who were not fully vaccinated. So generally speaking, by and large, this is true as of now. Whatever the science has been reported by World Health Organization experts and other experts of, for example, the medical research councils in different countries, that vaccination, fully vaccinated people are less likely to develop, very less, significantly less likely to develop serious outcomes of COVID-19, and also very significantly less likely to die of COVID-19 compared to those who are not vaccinated. So now coming back to India, if you look at the states, this was very interesting for me, because the state which is reported by our respected media, the fourth pillar of democracy, the state of Uttar Pradesh, which is reported to be the model state in the country, which is commended by Prime Minister and different important ministers, and as per the news, they also get acclaims and credits from World Health Organization. Uttar Pradesh, which I don't know what it is, because it could be a UP state project office. I'm not very sure what media is reporting, because if you look at the performance of Uttar Pradesh government on COVID, I, as a person who has been living here, has serious questions. The vaccination rate is very poor, appalling. It is 4.3% of population is fully vaccinated. 4.3. What is the global average? Sorry, the national average? The national average is, friends, about 10%, more than 10% of the population in the country is fully vaccinated. What about Uttar Pradesh? 4.3% in July 2021 as per news, and 5.6 some percent, 9% I think, in August 2021, in a news I read, probably in the Pioneer. So about half of the national average, that is where UP and Bihar are. Compared to Uttar Pradesh and Bihar, which are both states are doing not satisfactory in terms of ensuring full vaccination coverage for its population, and it is way below mark, way below the national average for vaccination. We also have very promising levels of coverage in terms of fully vaccinated people in that state, and that is Kerala. So Kerala, few northeastern states, I think it is one more state, probably it is Punjab. There are states which have vaccinated more than 15%, 15% of their population, and this was as of July 2021. That is the latest data I could find in a news item. So as of July 2021, when the national coverage was 8.8%, Uttar Pradesh had 4.3% of people who were fully vaccinated, whereas states like Kerala had over 15% of their population fully vaccinated. So almost double the national average. Number of people were fully vaccinated in Kerala, whereas half of the national average number of people were fully vaccinated in Uttar Pradesh and Bihar. If we are really losing time, it is race against time. Our government often says that we should not politicize these issues, but as the Lancet, the chief editor-in-chief of the Lancet, Dr. Richard Horton, had rightly said many years ago, that politics often is the ultimate determinant of health. It is the governance, it is the political decision making which should be pro-people that makes a huge difference in health outcomes. No wonder Kerala has much better health indices and human development indices, and some other states have much better human development indices compared to states like Uttar Pradesh and Bihar. This is not a time for patting our own back. This is a time for honest self-reflection and review, and honestly taking responsibility and not just event management mode, to ensure that people are fully vaccinated. Things like fake or counterfeit vaccines in India and Uganda, which was verified by the World Health Organization as well as by Serum Institute of India outside the national program of vaccination. I don't know what it means, but this was in the newspapers a few days back. This is very concerning. The shortage of vaccine, for example, is very, very concerning. On 21 June 2021, the vaccination drive got such a huge jump. About 8 million or more people got vaccinated. But then the numbers dropped significantly. Whereas the promise was to vaccinate 10 million every day. This is almost end of August 2021. But so far we have not hit that aspirational target of vaccinating 10 million people in 24 hours. This is not acceptable, friends, because we are running a race against time. If at all we are going to use the tool of COVID-19 vaccines and trying in giving us a best possible shot to and hope that we will be able to decimate the pandemic, end the pandemic, and rebuild our world in a more equitable manner. So we are really losing time, and however, I'm not losing hope. I really hope sanity prevails, and I really hope vaccination drive picks up very sincerely, very equitably, more important, very, very equitably, so that because we cannot end the COVID-19 pandemic just in Uttar Pradesh or India or Kerala. It has to be either global eradication of coronavirus, or we will lose it altogether. We are not living in bubbles. We are living, world is a family. We all know how cases of coronavirus is spread from Wuhan and now on every continent on the planet, including Antarctica. This is the way infectious diseases spread, and this is the threat we are facing. We are all in this together, truly speaking, and there is no mincing of words here, friends. Either we win together or we lose it all. So it is not just about ensuring significant number of people in India get vaccinated. It is about ensuring significant number of people get vaccinated all around the world, so that we are really able to put the pandemic behind us and also rebuild in an equitable manner. With this hope, let us come to the end of CNS Viewpoint, and tomorrow at 5 p.m. we will be back with some other issue in Spotlight. Thank you and all the best.